Hi, my name is Carrie Ketchum, and this is my surveillance presentation for STAT507. My topic is varicella or chickenpox and herpes zoster shingles. I'm interested in this topic primarily due to the implementation of the chickenpox vaccine occurring when my first child was born. Following my family doctor's practice for his own children, I actually didn't have my child vaccinated, and I had another child a few years later, and they actually didn't end up getting vaccinated until their teen years. I was kind of hoping that they would get chickenpox fairly early on, and they didn't. So we eventually had them vaccinated, but not when the vaccine first came on the market in the US. So I kind of wanted to do some research to see how that had all played out. A little bit about the history of chickenpox. Originally, varicella or chickenpox was thought to be a mild form of variola or smallpox, and it wasn't until 1767 when an English physician wrote a paper saying that he didn't think that was the case, that he thought chickenpox and smallpox were actually caused by a different virus. I noticed that there's a really large gap in time. Here we have in 1767, and then we don't actually have somebody coming along to strengthen that argument until 1892. And that's quite a gap in time. I mean, over 100 years. And that was causing quite some problems health-wise because they'd actually come up with a smallpox vaccine in 1796. And it turned out that a large number of people were refusing to get that vaccine because they'd already had chickenpox and therefore felt that they were immune to the much more serious disease of smallpox. And so that was very dangerous, and they weren't taking proper precautions to try to prevent contraction of smallpox. And luckily, eventually, William Osler came along and showed that having one disease didn't actually provide immunity for the other, and that made people a little more cautious about that. American virologist actually was the first to isolate the virus for varicella in 54, and then in 1974, the first vaccine was developed from what was known as the Oka strain, and that's actually the same strain that's being used today to develop the vaccine. So Japan was subsequently one of the first countries to initiate vaccination. That's not surprising since they were the ones that developed it. They do not practice universal immunization. They didn't at that time, and they still don't today. They primarily recommend that those people who have compromised immune systems, healthcare workers, individuals in close communities get the vaccine, but it's not something they recommend universally. And there's a couple other countries that don't do that. The UK doesn't either. Widespread U.S. vaccination actually began in 1995, and that was universal. They recommended that all children get that vaccine, and at that time it was a one-dose vaccine. We'll talk about the second dose being added later. Vaccine is very effective, offers complete protection for about 80% of individuals, and that remaining 20% that would get the disease do end up with a much milder case, many less lesions, much less symptomology with those cases where they had gotten the vaccine, and a shorter recovery time. So risk factors for chickenpox, similar to many other childhood illnesses like measles, mumps, rubella, when those were much more common, being just in close contact with an infected person because it is extremely contagious, being in the age group of less than 3 years old or in the peak incidence age group of 5 to 9. Anyone who has a compromised immune system, again, that's similar to many other illnesses. That's not going to be just make you more susceptible to chickenpox, but many viruses. Also having cancer, HIV, being pregnant, or the time of year. Now, the time of year, again, that's not surprising because we're, go back a few slides, we're used to having higher incidences of illness in late winter or early spring when we're kind of all trapped indoors together, and those germs can just be more easily spread. The surveillance questions that I asked were, when did implementation of the chickenpox vaccine begin to significantly reduce the occurrence of this disease in the United States? So I was just interested in seeing how infection rates decreased and how quickly. Where in the US, if anywhere, are widespread outbreaks still occurring? And has the vaccine for chickenpox been shown to provide any immunity for shingles? I've noticed that shingles seems to be in the news much more recently, and so I was wondering if there's any kind of link between the varicella vaccine and the interest, or actually just it seems to be more information out there about shingles. My first data source was the Varicella Active Surveillance Project, or VASP, and that was actually funded by the Centers for Disease Control and Prevention. Interesting to note that it was implemented in September of 1994, so that's prior to the vaccine being introduced. So it's good they have data from before the vaccine was actually even put on the market, and then it's still actually in practice today. Cases of varicella and herpes zoster were both reported, and you'll notice they had a wide variety of different kinds of reporting agencies, so hospitals and healthcare providers and clinics and daycares and prisons and all kinds of places with large populations of people. Also, you'll notice that it was only implemented in 3 different counties, and that actually one of them is no longer participating. They dropped out about 5 years in. But in those 3 counties, there's over 1.5 million people. So even though it doesn't sound all that big, it's actually quite huge. They had very thorough follow-up via phone or a house visit to confirm diagnosis, and they also followed up a few weeks later to see if anyone else in the household had developed the illness. And then they also collected specimens and had those sent to CDC's varicella zoster virus lab for testing. So just a really good data source. I also looked at the National Notifiable Diseases Surveillance Systems. This became important because the decline in varicella incidence dropped so dramatically in the VASP data that once the second dose was recommended in 2006, they really didn't have a whole lot of cases left that where they could monitor the further impact of that second dose. So they had to turn to a secondary source, and that was this NNDSS. And they use that primarily to help determine how that second dose affected those children being vaccinated. So you'll also hear that says by 2010, there was a total of 39 states required that were reporting of varicella cases, 38 states conducting passive case-based surveillance, and 31 meeting the CDC's criteria for what they called adequate and consistent reporting. So in 2000, there was actually, I don't have this on the slide, but there was actually only 10 states. By 2005, it was up to 26, and then by 2010, it was 31. So I'm going to do most of my reporting based on that mid-range number of 26, which was what, again, it was up to by 2005. My final source of data primarily was the varicella outbreak webpage, which is again maintained on the Centers for Disease Control and Prevention website. States are actually only encouraged to report chickenpox outbreaks, so that in itself is kind of a caution since submission's voluntary. I don't know how good a source of data that would be, but it was the best thing that I could find because with there being so many less outbreaks, there was no centrally located data source that I could find to track those in the United States. So this was the best I could do. They report the outbreaks through a common worksheet, and that's supposed to be submitted by your state health department. Question 1 results. Again, question 1 was, when did implementation of the chickenpox vaccine begin to significantly reduce the occurrence of this disease in the United States? There's 3 things that I really want to consider there. We have the annual number of cases of chickenpox or varicella, we have the hospitalizations, and then we have the deaths. And you can see right in this first point that I have that prior to vaccination, about 4 million people a year in the United States got chickenpox, and that has dropped by more than 3.5 million cases annually. So obviously that's a huge decrease. Also 10,500 to 13,000 were hospitalized, and that has dropped by about 9,000 cases a year. And then finally, there were 100 to 150 deaths each year attributed to chickenpox in the United States, and that has dropped by about 100 deaths. So that is a huge indication that the vaccine is being very effective. Again, these are data as of 2010. You'll notice the further data, if you have a chance to read through those, I won't be able to talk about all of them given our short time that we're allowed to share our information with you. But that some of the data, the VASP data, is bearing out those numbers, but it does it from 1995 to 2000, and then from 2000 to 2005. And then again, when the second dose was implemented, there's the National Notifiable Diseases Surveillance System data, and that actually goes from 2000 to 2005, begins 5 years later, because again, there wasn't enough states that were really doing a consistent type of reporting for the CDC to want to use that data until about 2005, and then after the second dose from 2006 to 2010. My second question about where in the US, if anywhere, are widespread outbreaks still occurring, I really couldn't find a lot of data on this, so my suspicion is that there aren't a lot of widespread outbreaks still occurring. There are still outbreaks, but those outbreaks have clearly declined in number, especially since the two-dose chickenpox vaccination program was implemented. And those outbreaks are also smaller and less severe. The last widespread outbreak that I could really find data on occurred in, I believe it's Vigo County, Indiana, and that was during the last few months of 2012. And that one was only 84 individuals, and it was quite the press headline to have just 84 people still having chickenpox. So given the fact that that's not hundreds or thousands of people, and that's considered a really widespread outbreak, I think that it's safe to say those outbreaks have definitely decreased in number and severity. My third question about shingles, just a quick overview of shingles. It's up to actually now nearly 1 in 3 adults developing herpes zoster or shingles at some point in their life, and that's about 1 million Americans every year, which is actually twice the number that are getting chickenpox now in the United States. Most of those cases occurring in older adults. The shingles vaccine, Zostavax, is actually just kind of a stronger version of the varicella vaccine. It's made from that same OCA strain, but is at least 14 times the concentration level. So it's kind of a booster vaccine to try to build up your immunity against having that virus reemerge in your system, which is what shingles is. It's the same exact virus as varicella that causes chickenpox. It just reemerges later in your system in life, and they're not really sure why that happens. So my question was, has the vaccine for chickenpox been shown to provide any immunity against shingles? And actually, I couldn't find any documentation that indicated that might be the case. And I did find a lot of documentation that actually was focused on whether, in fact, the opposite might be true, and that's that the varicella vaccine may be responsible for actually increasing the numbers of cases of herpes zoster. So that's what I chose to focus on. I don't think that the vaccine provides any immunity for shingles because I couldn't find anything to indicate that might be the case. So I found conflicting reports on this. Some studies said that they felt the varicella vaccine is responsible for the increase in shingles cases. Others indicated that that was not the case, and hopefully you'll have time to kind of read through those. So right now the data is conflicting. I guess it's probably safest to go with what the CDC is doing, which I took this quote on the bottom here directly from their website stating, "The CDC is monitoring the effects of varicella vaccination on the epidemiology of herpes zoster in the United States." So I think they're trying to say the jury's still out on this one. It's too soon to say whether or not there might be a link between the varicella vaccine and the increase in shingles. Limitations in my surveillance presentation. I felt like I had plenty of data to answer question 1 and that those were good sources. Again, data source for question 2 was voluntary, and so it's kind of harder to get a clear picture on the outbreak data, but since there isn't a lot of data out there, that does seem to indicate that those outbreaks have decreased greatly in number, and that's not something that they feel they need a comprehensive database to track anymore. And then again, on that third question, I definitely couldn't locate documentation indicating varicella vaccine might actually be helping provide immunity for shingles, and I actually found a lot of data indicating that some people believe it may actually lessen it. So again, jury's still out on that one. My final conclusions, in the 26 states with adequate and consistent reporting, again, that's as of 2005, cases of varicella had already declined markedly by about 45%, an additional drop of 77%. In cases by 2010, again, that's following the implementation of the two-dose vaccine protocol, which they implemented when they realized after about 4 or 5 years that the immunity was waning for some, again, probably because there wasn't the exposure to as many cases of the wild variety of varicella. So overall, the varicella outbreak or varicella cases has declined 82% from 2000 to 2010 in the United States, which is obviously a huge decrease. So very, very effective vaccine. Outbreaks are still occurring, but again, the vaccines clearly had a significant impact in reducing their number, size, and severity. And again, one more time, I couldn't find evidence indicating that the vaccine provides any immunity for herpes zoster or shingles, and we'll have to wait and see. And I'm interested to watch this to see what happens with this research, not there is, whether or not they determine that there is a link between the vaccine and actually the number of shingles cases. Last few slides are just my bibliography, so any and all sites that I used to get any of my information for this report, and then actually my works that I officially cited in my footnotes. Okay, I look forward to answering questions and to seeing everyone else's presentation. See you on the discussion board.